This is the model of, this is the anal canal, and this is the pelvic diaphragm, which is made up of levator and eye muscle, and the below it is lined by the superficial layer of the pelvic diaphragm. Above in blue color, this is the deep layer of the pelvic diaphragm. This is ischiorectal fossa or ischioanal fossa, which is full of the fat which give space for the distension of the anal canal, as well as it support the pelvic diaphragm, as well as it works as a cushion for the pudendal canal. And this is ischiorectal fossa, this is skin, and here is the anal canal. Anal canal, it is the caudal part of the gastrointestinal tube. It starts after the rectum and it ends at the anus. It is developed from both endoderm and ectoderm. This is the pectinate line up to here. It is developed from the caudal part of the hindgut, that is the endodermal origin, and below, from below up to here, this is developed from the proctodium, which is the ectodermal in origin. Okay, now this is the 3.8 centimeter long structure, and from this is the anorectal ring. Okay, anorectal ring is in between the anal canal and the rectum. From anorectal ring up to the, this is the pectinate line. This much is 15 millimeter, and this and this is also 15 millimeter up to the, from the pectinate line up to the white line of the Hilton, up to this much. It is also 15 millimeter, and this much area, the lowermost area, it is 8 millimeter. So this is upper zone in green color. In yellow color, this is the intermediate zone, and the lower zone shown by the white color. First come to the upper zone. It like any other like whole of the GIT tube, like the general plan, it is made up of from internal to external. It is made up of MS, that is the mucosa, submucosa, then muscularis, muscularis externa, and then serosa. Okay, and mucosa is again made up of three things: ilm, that is the epithelium, lamina propria, and the muscularis mucosa. Here the mucosa is thrown into the longitudinal folds. You are seeing the longitudinal folds in the upper area, and in each fold it is created by the folding of the mucosa itself, and each fold contain one superior rectal artery and superior rectal vein. Each fold, the branch will contain superior rectal artery and superior rectal vein. And below, this mucosa is continuous with the, this is known as anal column. This, due to the anal fold, this is anal fold, longitudinal ridges. Due to the anal fold, in between this there is a sulcus, that is known as anal column. It is longitudinally arranged in the upper area, and in the lowermost part it is continuous. The mucous membrane is continuous to form the anal valve, and the space created above the anal valve is called anal sinus. And the anal sinus, the submucous gland of anus opens, that is anal gland, and the opening of which is called anal crypt. Okay, and this is the pectinate line. And the type of epithelium is the simple columnar, like all other part of the GIT. Simple columnar type. And now this, the middle area, it is devoid of any sweat gland and sebaceous gland. It is covered by the non-keratinized stratified squamous epithelium. Non-keratinized. Okay. And it is from the pectinate line up to the white line of Hilton. And this, the lowermost area, it is the epithelium is keratinized stratified squamous epithelium, and it contains sweat gland and sebaceous gland. These yellow spots, these are the sweat gland and sebaceous gland. And here at the lowermost part, there is the longitudinal ridges which is gathering, and this is due to the presence of corrugator ani muscle. Due to the presence of corrugator ani muscle, it shows folding, a gathering of skin over here. Okay, as these two are developed from the ectoderm, they are supplied by the somatic nerve, and the upper one, the green area, upper zone, is supplied by the autonomic nerve. Okay. Now, this is the longitudinal muscle of the rectum. Longitudinal muscle of the rectum, it is continuous below, and internal to that in this red color, this is the internal anal sphincter. Internal anal sphincter up to the green area and the yellow area. It extends from the pelvic diaphragm up to the white line of Hilton. This is what? White line of Hilton. Internal anal sphincter, it lies outside, that is the MS, the muscularis externa. In the anal canal, the muscularis externa, outer longitudinal and the inner circular, but additionally on the outermost there is a skeletal muscle, that is the internal anal sphincter and the external anal sphincter. Internal anal sphincter, which is shown in this pink color, and it extends from the pelvic diaphragm up to the white line of Hilton, and it is underlying the longitudinal muscle of the rectum. As this is rectum and this is the longitudinal muscle of rectum, it lies internal to that, and outside, that is external to that, this is external anal sphincter. This is the deep external sphincter, this is the superficial anal sphincter, and this is subcutaneous external anal sphincter. All these are external anal sphincter which lie external to the longitudinal muscle. This is the conjoint sheath. Now after this is longitudinal muscle of the rectum, but after the pelvic diaphragm, it contain few fibers from the deep external anal sphincter, few fibers from the superficial external anal sphincter, few fiber from the internal anal sphincter, few fiber from the anorectal ring. All these fiber unite here and form the conjoint sheath. Okay, this conjoint sheath sends one sling at the junction of this intermediate and the lower zone, and this here it create the gathering of skin, and there is a sulcus over here also, and this is called anal verge. This area is known as anal verge, and the rest of it penetrate the subcutaneous external anal sphincter muscle. This is subcutaneous and external anal sphincter. This conjoint sheath, the various slings from here penetrate this muscle. Okay. Now about the clinical significance, fish fry. अगर fish fry खाओ तो फिर जीआईटी जवाब दे जाता है, एनल कनाल अपना एक्शन दिखा देता है। ठीक है। फिश फ्राई, क्लिनिकल सिग्निफिकेंस, एफ फॉर फीसर, आई फॉर इम्परफोरेट एनस, एस फॉर स्ट्रिक्चर, एच फॉर हेमरेज hemorrhoids, fish fry, F again for fistula, R for perianal abscess, and then Y for why, that is carcinoma. Okay, so fish fry, F for fistula. Fistula can be high anal fistula and the low anal fistula. High anal fistula, if this fistula opens above the level of anorectal ring, this is high anal fistula. It below the anorectal ring, this is the low anal fistula. I for imperforate anus, here is the, there is if there is imperforate anus, that is due to the non-disruption of the anal membrane. Here lies the anal membrane. If do not disrupt, then there is a membrane over there. This is a congenital anomaly, and this is known as imperforate anus. As for a stricture, H for hemorrhoids. It can be external hemorrhoids, internal hemorrhoids. External hemorrhoids, if below the pectinate line, that is external hemorrhoids, and it is painful as it is supplied by the somatic nerve. Internal hemorrhoids, when the hemorrhoids lie above the pectinate line, and it is painless. H हो गया. Then F is fistula तो हो गया. Fissure, if there is disruption of anal valve, this is called anal valve, and if there is a tear of anal valve, this is known as fissure. And if there is disruption of anal valve, rupture of anal valve, that is called sentinel pile. Okay. And because the bleeding occur because there is a anastomosis in between the superior rectal vein and the inferior rectal vein. This is a site where the anastomosis occur in between the superior rectal vein, inferior rectal vein, superior rectal artery, inferior rectal artery. As we all know that the blood supply above the pectinate line is the superior rectal artery. Superior rectal artery is the branch of the inferior mesenteric artery, and the superior rectal vein, the venous drainage is by the superior rectal vein, and that is the tributary of inferior mesenteric vein. And the below there is inferior rectal artery. Inferior rectal artery is the branch of the internal pudendal artery. Okay, internal pudendal artery is the branch of anterior division of internal iliac artery, and an inferior rectal vein is the branch of the internal iliac vein, which give rise to internal pudendal vein, and then internal pudendal give rise to inferior rectal vein. Okay, so there is a junction, and where there, due to the rupture of the anal valve, there is sentinel pile. Okay, fry, R for perianal abscess. If there abscess occur surrounding this region, and that is 4 types. Pick me, P for pelvirectal abscess, that is adjacent to the rectum. This is rectum and this is anal canal, adjacent to the rectum and above the this is pelvic diaphragm. Above the pelvic diaphragm, adjacent to rectum, this is pelvirectal abscess. Pick me, I for ischianal abscess. This is ischianal fossa. If this abscess lies in the ischianal fossa, this is called ischianal abscess. Then C, subcutaneous abscess. If this is perianal skin, and if the abscess lies deep to the perianal skin, this is known as subcutaneous abscess. Pick me, the submucous abscess. If the abscess lie deep to the mucosa, then it is called submucous abscess. Okay, this is about the perianal abscess, and then Y is for carcinoma. Okay, thank you. This is all about the anal canal.